Hello friends, this is Sanket and I welcome you all to Jogger Dada. And I'm back with fitness and health news of the day number 3. So let's begin. So finally, boon for typhoid patients. Hyderabad-based Bharat Biotech's Typhoid Conjugate Vaccine (TCV) has received the pre-qualification from World Health Organization. Currently, one-third of global population is at a risk of typhoid fever, which results in reduced school attendance, loss of work and wages, also lowered pregnancy outcomes and impaired physical and cognitive development of children. In 2016, an approximate 12 million typhoid cases came up, out of which there were 1,30,000 deaths. So that's why I was telling why an inexpensive Indian vaccine for typhoid can be a global boom. Bariatric surgery or weight loss surgery may cut down risks of heart disease for young teens when they grow up. A study has been published in the online Journal of Pediatrics conducted over 242 adolescents who were diagnosed with heart risk factors at the baseline. The results found that prior to bariatric surgery, 33% of the participants had 3 or more defined cardiovascular disease risk factor, but post-surgery, only 5% reported same, representing a significant reduction in overall likelihood of developing cardiovascular disease later in life. Caffeine levels in blood may help diagnose people with Parkinson's disease. A study published on 3rd January in the online issue of Neurology, a medical journal of the American Academy of Neurology, says that people who were diagnosed with Parkinson's had lower caffeine levels in their blood compared to the safe people or the people in the safe side. The study involved 108 people who had Parkinson's disease for an average of about 6 years and 31 of the same age who did not have the disease. The two groups were given 2 cups of coffee daily. The group with Parkinson's disease had significantly lower levels of caffeine in their blood. This can pave way for a possibly easy way of diagnosing Parkinson's, which is very difficult to diagnose, and in the early levels also when the symptoms cannot be traced easily. World Health Organization says that gaming addiction can be a mental disorder. The 11th International Classification of Disease, the ICD, which is getting modified after 26 years, it was last modified in 1992, will include the condition gaming disorder. So what are the symptoms? Impaired control over gaming, frequency, intensity and duration, increased priority given to gaming, continuation or escalation of gaming despite negative consequences. The draft document describes it as a pattern of persistent or recurrent gaming behavior so severe that it takes precedence over the other life events. Some countries had already identified this as a major health issue and have opened up clinics for diagnosing this disorder, and it takes generally 12 months to 18 months for coming out completely from this. Night shifts may put women at increased cancer risk. Researchers from Sichuan University in China performed a meta-analysis using data from 61 articles comprising of 1,14,628 cancer cases and 39,09,152 participants from around the world. The studies were analyzed for an association between long-term night shift shift work and risk of 11 types of cancer. Further analysis was conducted on female nurses working in regular prolonged night shifts. This revealed that the increased risk of cancer by 19%. Oh my god. Breaking down, skin cancer increased by 41%, breast cancer by 32%, and gastrointestinal cancer by 18%. These results might help in finding out medication for prolonged women night shifters. Also, women working in night shifts should go for regular checkup, and this will help them generally in all possible ways. And this is also an alarm call for women working in night shifts in IT sectors as well as call centers throughout India. So friends, that's all from today's health and fitness news of the day. Hope you like the series, and you can also let me know in the comments below. Until the next video, stay healthy and bye bye.